Hey there, it's Dr. Jim. Thank you for stopping by. The topic I have today is a good one, and it's one that I've been talking about for about 15 years, believe it or not. It's doctor shopping, and this is called Recognizing the Doctor Shopping Patient. So, first of all, what is doctor shopping? Doctor shopping involves the practice of making multiple appointments and visiting numerous physicians and specialists in order to obtain multiple prescription medications that will either be used and consumed by the person shopping for the medications, or they turn around and they sell these meds for a profit. So it's far more common than people know, and the majority of doctor shoppers are drug seeking people who are addicted to specific and particular types of medication, like painkillers. Or they will supply these drugs to other people. So, for some, it's a business, and it's a big business in many cases. Profits are in the hundreds of thousands, six figures annually. These people are pros. I have to point that out. They're very professional at acting like a new patient or visiting a doctor from out of town, or exaggerating or faking medical problems to obtain prescription medications. Now, can you imagine how good you have to be at faking symptoms of ADHD in order to get those psychostimulants like Vyvanse and Ritalin and so on and so forth? And you're faking these symptoms in front of a physician who is an expert in ADHD. You have got to not only be really good, but you have to be profoundly confident in your abilities and skills. And you're so convincing that the doctor writes a prescription for you. Why would people fake ADHD? Because psychostimulant drugs are some of the most sought after drugs in America right now. They're second to pain meds and opioids. When children take psychostimulants, they slow down. Their ability to concentrate increases and their focus becomes sharper. For older adults, it speeds them up like amphetamines or cocaine. So they have quite the opposite effect from a child to an adult. That's why they're so popular, I guess. What about being so persuasive about faking symptoms of pain in front of your doctor or a pain specialist that he or she writes a prescription for pain meds every month? Every 30 days you have to go in, you have to be seen, you have to keep faking those symptoms, and you're so good at faking those symptoms that doctor writes the prescription again. What kinds of drugs are these people seeking? The majority of doctor shoppers are looking for very specific drugs and will find the right doctor or the right specialist to target in order to obtain them. Most are seeking narcotics like OxyContin, stimulants like Vyvanse, barbiturates like Seconal, probably haven't heard of that one for a while, that's old school, benzodiazepines like Xanax, Valium, Ativan, and tranquilizers, hypnotics like Lunesta. People are also after psychiatric medications, including antidepressants, anti-anxiety drugs, which are called the anxiolytics, and even antipsychotic medications. Let me ask you this question. Do you think you could fake symptoms of a psychiatric disorder or an emotional condition long enough to keep getting meds from your physician? I'm Dr. Jim Collins. I'm interested in that topic. I hope you are. And that's why I want to invite you to my blog, drjimcollins.com, where I discuss topics like this and many more. So stay well. Check out my blog. See you soon.